In this video, we're going to be going over patellofemoral pain syndrome, specifically which exercises you need to use to be able to help patients get better. And we're taking the concept of progressive tendon loading and relating it to progressive loading exercises for patellofemoral pain syndrome. Where it looks and what we're looking at is the load that's occurring in the patellofemoral joint, and we're monitoring that load. We're ranking these exercises based on the different loads that are experienced in the joint, and then we're giving patients evidence-based progressions to be able to help fix the problem, get them better, and to get them out of pain, remain out of pain. Now, the problem is that while patellofemoral pain syndrome is one of the most common things we see, unfortunately, it has pretty bad outcomes in the end. After 5 years, we see that 50% of patients are still having pain. So unfortunately, what we're looking at is clinicians are giving exercises that are either too general or not specific enough to tailor what is needed for the patient. Now, what you need to know is that patellofemoral pain syndrome really needs to have exercises that are progressively loading the joint. Now, new research has ranked these different loads for the exercises that we commonly use, so we can look at each individual one and figure out why either the patient's not getting better or how to get them better. Now, the other thing we need to know about loading is that loading is broken up into several different categories. It's broken up into different loading rates, impulse, and the peak load. So let me explain that a little bit more so we understand this concept, so then we can relate it to how patients get better for patellofemoral pain syndrome. So for progressive loading for the patellofemoral joint, we're looking at gradually and incrementally increasing the load on the joint. That's going to fix the biomechanics, it's going to strengthen the muscles, and to know which exercises and what load to provide, we first want to look at what are the different types of load. So the loading peak is going to be the maximum force or stress applied during an activity. Think of just the maximum stress or load that's put through the joint through the exercise. So a good example of this for patellofemoral joints is going to be a deep squat. Another good example for the Achilles is going to be a single leg forward hop. And then we can also think a single leg decline squat for a patellar tendon. So all of these things are going to be important. Now the peak load is going to be what you want to progress first. You want to up the peak load because that's going to be the capacity they can take to any force through the joint. But then the other thing, and the next thing you want to think about, is the loading impulse, which is going to be the total time the force is applied over a period of time. So basically the amount of force, the amount of stress that's in the joint over a longer period of time. Let me give you an example. Isometrics have a lot of loading impulse because they take a longer time. For example, a 45-degree wall sit for the patellofemoral joint, or an isometric heel raise. Slow exercises are going to have a higher loading impulse. But the reason we're going to progress this second is because we know they can take the peak force or peak load, then we want to elongate that time a little bit. Because what we're working towards is increasing their tolerance to the loading rate. This is what we do towards the end of rehab. Examples of this are going to be running and rebound jumps, drop jumps, or another good one would be like repetitive hops, quick hops. The idea is that the loading rate is the speed at which the load is applied to the joint. So now that we know loading peak, impulse, and rate, we can relate that to patellofemoral pain syndrome. Specifically, what we want to look at is the 3 tiers that the American Journal of Sports Medicine has ranked as different tiers of patellofemoral load. And within those tiers, we see the loading impulse, the loading rate, and the loading peak. So that's going to be what we're going to consider when we're looking at recovering a patient and getting them better. Now, if you want, Running Specialist Report subscribers can go ahead and log in to Runner Resources and check out all the data sets of the loading peak, impulse, and loading rate. And you can also see a worksheet in there that you can put in different things you want to progress. So let's say you want to progress loading peak first. You can progress that first and reorder all the exercises based off just the loading peak. We can also do that on loading impulse and rate too. For a lot of runners, we want to focus on improving their peak to impulse to rate. So what do we do with that? And here's the order that we're going to think about. So the first tier of exercises are going to have things like a double leg squat. And they're going to progress to a single leg squat. And we're keeping the range pretty low here, down to 60 degrees. And at the end of this, we're looking at increasing that double leg squat all the way down to full depth. As you can see, the black part here in the chart is going to be the loading peak, and then the other two are going to be impulse and rate, which I'll get into in just a second. But the first thing we're doing is working on getting that squat depth down and that they can tolerate some of that squat depth. Then in tier 2, we're still progressing the loading peak, but we're going to now focus on adding a little bit of the loading impulse as well. So now we're going to add things like a lunge. Now we're going to add things like a 3-second Spanish squat. So we know prolonged holds, we know things that are going to be a longer time are going to have a longer loading impulse. Now this goes under the whole load that's put on the patient, but if we can keep the peak or the loading peak down relatively, we can increase the impulse a little bit more. So as we rise up with our loading peak, now we're doing things like being able to get a longer prolonged hold, a squat position hold. This can increase our capacity of the joint to tolerate forces, and then we can start looking at the loading rate. Now I want to pause here 1 second, because in these tier 2 exercises, you can see there's a lot of variability. There are things that are such as lunges, there's full single leg squats. All those things are in particular important to know. You can also add more weight, more load to all these exercises and do heavy resistance training to be able to get this strength to be better so that patients can start to take impact forces and start to increase the loading rate. Every patient's a little bit different, and here's where our clinical decisions come in of what we want to progress and when. How much strength do they need before they get to some of these jumping activities? And the question isn't very simple, but what I can say is we want to increase the peak, increase the impulse. We want to increase that with weight, oftentimes get them down to things like 10 rep max, 6 rep max, before we start putting in a lot of advanced plyometrics. Because at the beginning phases here, you can see, for example, the 2-leg repeated lateral jumps are a much faster loading rate, but they don't have a ton of peak forces. So this is going to be something you can do to start to introduce some of the jumping. And you can isolate it. Things like a single leg drop landing has a high loading rate, but doesn't have a lot of peak force. It doesn't have a lot of impulse. Because remember, this all makes up the index, all makes up the overall load that's put on the patellofemoral joint. So as we progress here, we get into things like forward hops, single leg forward hops and lateral hops, and then we're getting into split jumps as well. And we can really see this is progressing here into a lot more jumping and plyometrics. The reason why is because we know runners are going to suffer and are going to oftentimes get hurt from a high loading rate. Running naturally has a high loading rate because it has a lot of quick impact forces. We want runners to be able to overcome that, and that's oftentimes the reason that they're getting hurt in the first place. As we progress runners beyond this, so first we want to think of a drop jump or a single leg drop vertical jump. Then we want to think of a counter movement where we're adding more knee flexion. That increased knee flexion at the bottom of the jump is going to put more force through the body and through the joint. So we want to think about that force, how it's going to put and be used in the joint, have enough strength to overcome it and tolerate it. So then what do we get into is our tier 3 exercises. This is going to be like our fat max forward hops. This is going to be like running and cutting. This is going to be repeated forward jumps. These are all really good ways to add a lot of loading rate. And now we can also see here that our peak forces are still not really high, and our impulse is not high almost at all here. And the reason for that is because you don't oftentimes get loading peak, impulse, and rate to be really high with patellofemoral joint exercises. A lot of these are going to either load up the joint quickly or they're going to put a lot of peak force on it, but they don't usually add in a lot of time with that, unlike the Achilles tendon, which we can go on to in a different topic. However, this is a really important progression for runners. And the reason why is because we're prioritizing to save the loading rate to last. That's the thing that oftentimes hurts runners. That's the thing that we want to think of the most. But for some patients, let's say a resistance or heavy weightlifter, they might more be thinking about peak force and impulse. And maybe the rate doesn't matter as much. We don't need to progress it as much because it's not functional for them. But we do need to really get their peak forces up really high before we start to increase the impulse. Or maybe they can only only progress the impulse in time with low peaks, low weight, low resistance. However, it is something that they're able to get more and more and more of. The reason why I tell you all this is because truly this is where practitioners come in. We think about the different loading rates, the speed, the impulse, all the different factors that come into a load that's sustained on the patellofemoral joint. We use that to figure out how to help patients the most. And for runners, it's usually going to be loading peak first, impulse, and then loading rate. So we only do the loading rate stuff and the plyometrics when we're starting to get enough stability out of the knee, and we also have hip and ankle stability as well. That's obviously needed to make sure you're having good form. But that's how we're going to progress these folks so that they can slowly get used to and fix all the biomechanics that is needed to be able to get back to running and not have a problem. Go ahead and try that with your runners and see how it goes.